10 common medications that can damage your kidneys. Did you know that some common medications you might take for pain, high blood pressure, or infections could quietly be damaging your kidneys? While these drugs are often essential for managing health conditions, they can also pose hidden risks to your kidney function. In this video, we'll explore 10 commonly prescribed medications that can lead to kidney damage if not monitored carefully. Watch the video until the end to uncover the one crucial medication you might be taking that's silently harming your kidneys, knowledge that could save your life. Let's get started. 1. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. Non-steroidal anti-inflammatory drugs, NSAIDs, are widely used for managing pain, fever, and inflammation. These drugs are accessible over the counter and are commonly prescribed for conditions such as rheumatoid arthritis, menstrual pain, and general inflammation. Some of the more familiar NSAIDs include ibuprofen, brand names like Advil and Motrin, naproxen, Alev, naproxen, meloxicam, Mobic, and diclofenac, Cambia. These medications are generally well tolerated, but they are not without risks. One of the primary risks associated with NSAIDs is their impact on kidney health. NSAIDs work by inhibiting certain enzymes, COX-1 and COX-2, that play a role in inflammation, but these enzymes are also involved in maintaining proper blood flow to the kidneys. By blocking these enzymes, NSAIDs can reduce blood flow through the kidneys, leading to kidney damage or even kidney failure in severe cases. This risk is particularly pronounced in individuals with heart failure, liver disease, or pre-existing kidney problems. While occasional use of NSAIDs in recommended doses is unlikely to cause significant harm to the kidneys, chronic or excessive use can lead to long-term damage. It's generally advised to take NSAIDs sparingly at the lowest effective dose and for the shortest duration possible to minimize the risk of kidney damage. Those with underlying health conditions or those who need to use NSAIDs regularly should consult a healthcare provider to assess the potential risks. 2. Diuretics, like hydrochlorothiazide. Diuretics, often referred to as water pills, are another class of medications that can affect kidney function. These drugs are primarily used to treat high blood pressure and heart failure by promoting the excretion of excess fluid and sodium from the body. Popular diuretics include hydrochlorothiazide, furosemide, Lasix, spironolactone, aldactone, and triamterene, direnium. While diuretics are typically well tolerated and effective in managing conditions like hypertension, they can cause kidney-related side effects, particularly acute kidney injury. This occurs because diuretics lower blood volume, which can disrupt the kidney's ability to filter waste effectively. Older adults and those with pre-existing kidney conditions are at higher risk for developing kidney problems when using diuretics. However, it's important to note that not all diuretic use is harmful to the kidneys. When taken at the prescribed dose and under the supervision of a healthcare provider, diuretics can help manage health conditions without causing kidney damage. The risk of kidney injury is more likely with higher doses or when diuretics are used in combination with other nephrotoxic, kidney-damaging medications. Individuals taking diuretics should have their kidney function monitored regularly, particularly if they are at higher risk for kidney damage. 3. Angiotensin-converting enzyme, ACE inhibitors like lisinopril. Angiotensin-converting enzyme, ACE inhibitors, are a class of medications used primarily to manage high blood pressure and heart failure. These drugs are easily recognizable by their pril suffix, with common examples including lisinopril, zestril, benazepril, lotensin, enalapril, vasotec, and ramipril, altasi. ACE inhibitors are often considered protective for the kidneys, particularly in patients with conditions like diabetes or hypertension, as they help reduce blood pressure and the workload on the heart and kidneys. However, there is a paradox with ACE inhibitors. While they can protect the kidneys in some situations, they can also cause kidney injury in others. This is because ACE inhibitors are cleared from the body by the kidneys, and if the kidneys are already compromised, these drugs can further impair kidney function. The risk of kidney problems with ACE inhibitors is higher in people who are dehydrated, taking other nephrotoxic drugs, or have existing kidney disease. In such cases, healthcare providers often start patients on a lower dose of the medication and closely monitor their kidney function through routine blood tests. Despite these risks, ACE inhibitors remain a cornerstone of treatment for hypertension and heart failure, and their benefits generally outweigh the potential for kidney damage when used appropriately. 4. Iodinated radiocontrast agents. Iodinated radiocontrast agents are contrast dyes used during imaging tests such as CT scans to enhance the visibility of organs and blood vessels. While these agents are valuable for diagnostic purposes, they can also pose a risk to kidney health, particularly in individuals with pre-existing kidney disease or other risk factors like dehydration. Kidney damage from iodinated radiocontrast agents, also known as contrast-induced nephropathy, typically occurs within 24 to 48 hours of exposure to the contrast dye. The risk of kidney injury increases in individuals who have chronic kidney disease, low blood volume, or are taking other nephrotoxic drugs. To mitigate the risk of kidney damage, healthcare providers may use a lower dose of contrast dye during imaging tests for individuals at higher risk. Additionally, hydration before and after the procedure can help reduce the likelihood of kidney injury. It's essential for patients undergoing imaging studies with contrast to inform their healthcare providers of any pre-existing kidney conditions so that appropriate precautions can be taken. 5. Vankomycin. Vancomycin is a potent antibiotic used to treat serious bacterial infections such as those caused by methicillin-resistant Staphylococcus aureus (MRSA). It is often administered in a hospital setting where healthcare providers can closely monitor the patient's response to the medication. Kidney damage from vancomycin, known as vancomycin-induced nephrotoxicity, typically occurs within 17 days of starting treatment. Fortunately, kidney function usually improves after the medication is discontinued. However, close monitoring of kidney function is essential during vancomycin treatment, as the risk of kidney injury increases with higher doses and longer durations of use. Pharmacists and prescribers work together to ensure that the vancomycin dose is appropriate for the patient's needs and that kidney function is monitored regularly throughout treatment. In some cases, dose adjustments may be necessary to reduce the risk of kidney damage. 6. Aminoglycoside antibiotics like gentamicin, tobramycin, and streptomycin are another class of medications known for their potential to cause kidney injury. These antibiotics are typically administered intravenously, I-4, in hospital settings to treat severe bacterial infections. The risk of kidney damage with aminoglycosides is higher in individuals with chronic kidney disease, dehydration, or those who have been receiving these antibiotics for more than 10 days. The nephrotoxicity of aminoglycosides is well documented, and healthcare providers closely monitor patients receiving these medications to adjust doses as needed and prevent kidney injury. Aminoglycosides are generally reserved for situations where other antibiotics are ineffective, and the benefits of using these powerful medications often outweigh the risks. However, patients receiving aminoglycoside therapy should be aware of the potential for kidney damage and work with their healthcare team to minimize the risks. 7. HIV medications like Truvada. Certain medications used to treat HIV, particularly those containing tenofovir disoproxyl fumarate, TDF, have been associated with kidney damage. TDF is found in medications such as Truvada, Viread, and Stribild. These drugs can cause acute kidney injury in some cases, especially in individuals with pre-existing kidney problems. Patients taking HIV medications like Truvada should undergo regular kidney function testing to ensure that their kidneys are not being adversely affected by the treatment. Healthcare providers may adjust the dose or switch to a different medication if there are signs of kidney damage. Newer HIV medications such as tenofovir alafenamide, TAF, are less likely to cause kidney damage. Combination products like Descovy and Biktarvy, which contain TAF instead of TDF, offer a safer alternative for individuals at risk of kidney injury. 8. Other antiviral medications. Antiviral medications such as acyclovir, Zovirax, and ganciclovir can also pose a risk to kidney health. These medications can form crystals that do not dissolve well in urine, leading to blockages in the kidney's filtration system. This side effect is more likely to occur in individuals who are dehydrated or have pre-existing kidney disease. Foscarnet, another antiviral medication used to treat viral infections, is particularly nephrotoxic and can cause kidney damage more easily than other antiviral drugs. Healthcare providers closely monitor kidney function in patients receiving Foscarnet to prevent serious complications. Hydration and careful monitoring of kidney function are essential when using antiviral medications that carry a risk of kidney injury. Patients should inform their healthcare providers of any kidney-related concerns before starting antiviral therapy. 9. Zoledronic acid. Zoledronic acid, reclassed, is a bisphosphonate medication used to treat osteoporosis and reduce the risk of fractures. While it is generally effective for bone health, zoledronic acid has been linked to rare but serious cases of kidney damage. The FDA has issued warnings regarding the potential for kidney injury with zoledronic acid, particularly in individuals with pre-existing kidney problems. Reclassed and other versions of zoledronic acid, such as Zometa, are typically avoided in individuals with abnormal kidney function. Healthcare providers assess kidney health before prescribing these medications and monitor kidney function throughout treatment to reduce the risk of complications. 10. Calcineurin inhibitors like tacrolimus. Calcineurin inhibitors such as cyclosporine modified, Neural, and tacrolimus, Prograf, are immunosuppressant medications commonly prescribed to individuals who have undergone organ transplantation. These medications help prevent organ rejection by suppressing the immune system, but can also cause kidney damage. The risk of kidney injury with calcineurin inhibitors increases with higher doses, and in individuals who are already at risk of kidney damage. Despite these risks, the benefits of calcineurin inhibitors in preventing organ rejection often outweigh the potential for kidney damage. Healthcare providers closely monitor kidney function in patients taking these medications and may adjust doses as needed to minimize the risk of injury. When to see a healthcare professional about suspected kidney problems. Kidney damage from medications is not always easy to detect, as symptoms may not be immediately apparent. However, there are several warning signs that individuals should be aware of when taking medications that can affect kidney health. If any of the following symptoms occur, it's important to seek medical attention promptly. Blood or foam in the urine, dark-colored urine, noticeable changes in urinary frequency or output, lower back or flank pain, difficulty urinating or decreased urine output. If any of these symptoms are present, a healthcare provider may order lab tests to evaluate kidney function. Based on the results and the medications being taken, adjustments to the treatment plan may be necessary. In some cases, it may be possible to switch to a medication that is safer for the kidneys. While medications are essential for treating and managing a wide range of health conditions, it's important to recognize the potential risks they pose to kidney health. Many commonly used drugs, including NSAIDs, diuretics, AC inhibitors, and antibiotics, can cause kidney damage if not used appropriately. However, with proper monitoring and dose adjustments, the risks can often be minimized. minimized. Patients should work closely with their healthcare providers to ensure that their kidney function is regularly assessed, especially if they are taking medications known to carry a risk of kidney injury. By staying informed about the potential risks and taking proactive steps to protect kidney health, individuals can continue to benefit from necessary medications while minimizing the likelihood of kidney damage.